We are now recording.
All right. So with that, I'm going to hand it off to Michael Donnelly, who is co-leading the testing track for the HL7 Fire Connectathon that's going to be happening May 13th through 15th, and ask him to take it away.
Mike, you might be muted. I was just getting it going. Can you see the presentation?
Yes, I can.
Yes, we can.
Excellent. Maybe try to go back to the. Alrighty. All right. So welcome everybody. Figure you're all familiar with SANER, but you might need to know a little bit about the HL7 Fire Connectathon. So for people who have not participated before, an HL7 Fire Connectathon is an event usually takes place the weekend before an HL7 working group meeting. In this case, because there isn't an in-person meeting, it's going to be a virtual event over Wednesday through Friday of mid-May. And it is an opportunity to get together with other people who are working on solving a similar problem and test out the solutions that you have so far and figure out what works and what doesn't. And generally iterate through a lot more quickly than you would outside of this scenario, since you don't have to go very far to catch up with people who you're working with. It is not a hackathon. Certainly you're welcome to attend if you don't have something, but it works a lot better if you've got something ready to go and a plan of what you're going to test. There are some links in here, and for anybody who doesn't have it already, we can make this slideshow available to you. So this is a generic slide from the template. You can actually, you know what? I'm going to pull this screen up so we can see it. So there's a page on HL7's Confluence site that describes all of the details from the track that we're planning to do. A lot of this is duplicated in the slideshow. This is the source of truth. So this is what we're going to keep updating the slideshow. We won't necessarily. And so the first question you're going to want to ask yourself is, if you're attending, what is it that you plan to do? Is your system going to be a measure source or a measure consumer, which we'll get to a little later? Which scenarios do you plan to participate in? And what do you need to do to get ready for those scenarios? There is going to be a pre-Connectathon survey where you can sign up and indicate what roles you're planning to do and what scenarios you're planning to do. That's something that they haven't gotten running yet. If the people running the Connectathon overall don't do that, we'll just do our own. But I want to give them a little more time to try to get together. Okay, so registration is already open, and there's a link here how to register. We're having the orientation meeting right now. This is the dates for the event itself, and I'll send out meeting requests for this to everybody who's listed as a participant or signed up as a participant.
So while Michael is going through slides, I am posting links to everyone in chat for all of the critical information that he has links for in the deck, and the deck will be made available later.
Excellent, thank you, Keith. Before I move on to the details of our track, what questions do people have about how the Connectathon event works in general?
You posted this registration link here. So does that mean everybody on the Esri team needs to go here and register individually? Do we register as a team? How does that work?
That's a good question. Keith, do you know the answer to that? I know in the past from Epic, each person who's participating has registered.
I think it's a nominal fee this time round because it's virtual, but I think it's designed for each individual to register.
Awesome.
Yeah, I can confirm that is the expectation, yes.
But at this time around, they're not having to provide rooms and lunches, so it's going to be a little bit easier.
So the fee is an individual participant fee, just to clarify.
Correct.
Okay.
Yes.
And I've never been involved in one of these. Is there a test bed or a proxy? Are all the systems connected peer-to-peer? Or if I'm skipping ahead, then tell me to be quiet.
Actually, this is a great time for that question because that's a general thing for this. Sometimes there are testing tools, but it's generally not formalized or heavy. So one of the things that we're going to have available is a list of the endpoints that other participants are making available. And that way you'll know everybody you can test with and where you can get to them. I am hoping somebody can put together a test script for Postman. It's something I know how to do. I don't know how much time I'll have, but that will let servers test their stuff even if clients are not available at the moment. But other than that, there's no formal test harness. Good question. What other questions do people have?
And for the virtual event, is there a common communication tool, method, scheduling, etc.?
There will be three things. There will be the chat.fire.org Zulip server, and we'll be able to communicate in there in the COVID-19 thread. There will be a WebEx that anybody who wants to can log into while they're working so we can talk to each other and kind of the social feel of all of it. And we'll have a number of scheduled meetings, plus the opportunity for unscheduled meetings to discuss specific issues. What other questions do you have?
We had an internal meeting yesterday at Esri where we're looking at this, and I think some of our developers were looking at these Fire servers that were out there and linked, and there was nothing there. Has that changed?
Why don't we get to that part later?
Okay.
Okay, so I left in something from the last, you can ignore that first one there. But there are links here to the SANER implementation guide, plus the GitHub wiki, where we have minutes for these meetings. The track definition and Confluence that I showed you earlier. Conman is a tool for managing these tracks. It isn't up and running yet. Presumably it will be, and I'll share a link when it is. And this is our stream on the Fire chat server. And if anybody isn't familiar with Zulip, it's totally worth going to. That's really the big spot where the Fire community discusses things. And while there are native clients, you can use it as a web client. Pretty low barrier to entry.
It's very much like Teams or Slack, but honestly, I think it's got better tools for managing channels and being able to access channels, having used all three of those.
I've only used Teams, but on that one, I definitely agree with Keith. I like Zulip a lot.
You know, I was just noticing your stream on COVID response has 226195 in front of it. Do all of them? Because there's a different one.
I'm assuming that is a stream ID and then the stream name is appended to it.
Or prepended?
I prepended.
Oh,
But
let me
Or, yeah,
actually
no, I
see.
think you're right. I think you're right. I think it's the stream ID and then the stream name is.
Mm.
So that actually shows that you copied the link, I guess, huh?
Yeah.
And there are links here to send messages to me or Keith on Zulip.
Yeah, you're right. I just did it, so it works. Even though that's not in the name, it's in the link.
Right. And lots of things in Zulip, if you right click, you can get a link to go exactly to whatever specific spot you're on. I just realized I don't have my video on and I'm gesturing, so I may as well get you turned on. Okay, so the SANER track. The track leads, I'm one of them. I'm Michael Donnelly. I work at Epic. I've been doing health IT interoperability for more than 15 years. I've done the IHE Connectathons since 2005 and the Interop Showcase and a bunch of HL7. How about you, Keith?
So Keith Boone and I have been doing IHE Connectathon since about 2003 and HL7 Fire Connectathon since like the very, I think the second one. I've been involved and been involved in interoperability in healthcare since about 2003 and standards development since about 2000, 2001.
Nice. What standards did you work on before healthcare?
XML, XSLT, XPath, XPointer,
Very
DOM2. My product manager was chair of XSLT. Our chief technology officer was co-editor of XPath. So
nice.
I worked with a lot of the people who were at the foundation of XML.
That makes some of your comfort with CDA make more sense.
Yes.
Cool.
Yes, and it's funny thing is that a lot of the people I know who've gotten involved in CDA from the SGML and XML communities are people that I've known from before then.
Right on. Okay, so like I said, Conman and a participant survey will be coming. For now, there is a list in here. And anybody who's on the call who is not on here yet, you're welcome to edit the page and add yourself or post on Zulip and Keith or I can do it for you. Okay, so after that, we'll talk about, or coming up, we're going to get to the specific stuff for SANER, the goals for the track, the servers and clients, and the scenarios. Okay, so our goals. We want to mature the standard. We want to, and this second one is, I think, the biggest thing that I have gotten out of events like this in the past, which is identifying gaps, which generally means identifying assumptions, where there's some handoff where I'm supposed to pass something to somebody else, and we haven't worked out something about the protocol. We haven't worked out how I'm going to securely identify myself. Whatever it is, when we actually wire our stuff up and give it a try, you can easily tell, oh yeah, there's a gap here. I'd like to, yes, you're a wonderful cat. I'd like to give people an opportunity now to say any additional goals that they'd like at a high level that we should address. All right, there'll be another.
I was going to say this is an opportunity for Mark Scrimshire's team to talk about smart on fire authentication.
Yeah.
Yeah,
Can we talk about that during scenarios?
sure.
Okay.
Well, I think one of the additional goals is to address security and authentication.
Okay. Then I will.
We can get into the details when we get to.
And then also reporting out, right? From the intermediary.
Ah, the intermediary, yes.
Yeah.
And
I'm still trying to kind of learn the rules of the game here so far, but you know, I mean, Esri's goal in participating in this, and we've got, you know, we're working directly with the WHO at the international level right now to share data between countries. You know, we've got front ends to the National Healthcare Safety Network. We're working with every county and state health department, most Fortune 100 companies. I'm working with Epic, Cerner, Allscripts, and every other healthcare IT vendor that's out there. So our goal right now is, figuring out how to leverage this project to address the shortfall that's happening out there. We've already got visualization tools, hotspot tools. In these initial discussions, we've heard about, how you guys go in and drop points and drop a box around them to identify all the fire resources in a particular area versus actually doing real, spatial type of analysis. So, we're just trying to figure out how to take what we're seeing happening with, all the clients that we're working with right now and make it a little bit more location aware, and just try to figure out how to, make this process a little saner.
Thank you for that tagline.
That's too easy.
Okay.
Love to understand what would help you in terms of being able to do some of that. If there's if there's specific details that you're looking for, do let us know as we're going through this.
Understood.
Okay, so on to roles. Anyone who's going to be participating will be playing a role or potentially multiple roles. The measure source is what generates the data or provides the data. In order to be the measure source, you have to have local data that you can use to generate a measure report resource. And you should be able to either expose a fire search for measure report or be a client that will do a measure report create on another server. Measure consumer is what receives them. So they have to be able to consume measure report resource. They should be able to do the inverse of the shoulds from last time, which is act as a client that would do a measure report search or expose a measure report endpoint at which another client can create a resource. And this is getting back to what somebody mentioned in goals, you should be able to generate a report, summary, or other artifact with the measure data that you'd consumed. Now, there is a third, where are we? There's a third system role defined in the SANER spec, and there hasn't been a lot of discussion about it on Zulip, so I didn't know whether this is something people were looking at doing. Is there anyone who's interested in acting as measure intermediary in the Connectathon track?
So from my perspective, this is Keith. One of the sort of coping mechanism pieces that I was looking at was being able to bridge the gap from somebody who is able to basically do the, so you've got somebody doing a create and somebody else that is doing a pull, and actually that's really a fire server in the middle.
Right.
But then you also have the other sort of challenge where you've got I'm trying to figure out what the reverse path was on that.
Well, to step ahead, Symptomatic, like we have something that does work as a proxy or an intermediary. We were bouncing around with being both a consumer and a producer source provider. So you have one tentative party that's interested, and we like that's something that we're working on internally.
Yep. And then the other place for an intermediary is to be able to take multiple reports and aggregate them up at county or regional level,
Right.
And from your perspective, and I think also from Esri's perspective, that's where that sort of that location awareness aspect comes in, of being able to say, well, I have reports from, you know, these hospitals in this zip code, and that's this HSA or this county or this state, and here is the aggregate result from all of those.
And an edge case in that is one
I'm
off.
sorry, the person who's speaking is really hard to hear.
Hello, this is Abigail. Am I the person that's hard to hear?
Yeah, Abigail, it sounds like you're on a wireless speakerphone or something.
I am on a cellular phone, yes. Yeah, and so as part of that, one of the edge cases is going to be independent reporting, whether that's nursing homes or one-offs. So yeah, like there's some extra edge cases there.
So from an aggregation standpoint, is this aggregating before it gets to a fire server or after it's in the fire server as measured reports? I mean, what are you referring to here?
Well, go ahead, Abigail.
Oh, I'm just saying is that we have the capabilities of doing both. So you tell us,
sure,
as it were.
Okay.
Yeah, I thought, you know, real quick, I'll weigh in here. I thought in our last call when, you know, Audacious Inquiry kind of briefed us on this, they said we would be looking at 3 different scenarios: an individual facility report, an aggregated regional report, maybe a health system is collecting the information and aggregating it up out of one, you know, location, you know, that represents the entire health system. There was this individual facility report server that was mentioned. There was a simulated report server, which I wasn't quite sure what that meant, and then an aggregated regional report server. So that was my understanding up until this point.
So does it make sense for us to talk a bit about Smart on Fire and how we would leverage that to?
Well, let's get through some of the questions.
Yeah, I have one more question on the intermediary role. So, and I don't know if this falls under this measure source or intermediary. So, and I don't know if this is even still in play, but early on, of course, we were looking at CSV from CDC and FEMA, and then creating measure reports from that. So is that that's certainly something I can do as an intermediary. And does that fall under intermediary or under source? Because it looks like the source is expected to produce the measure report and not simply the artifact.
So I think we probably want to get into a little bit more clarification of the different kinds of intermediaries. Okay. Certainly being able to go from CSV to measure report is something that like we've already got developers working on building right now. And I have been using to build sample data from CSV files. Also going from measure report to CSV format, maybe to route to a system that accepts CSV files as a way to do updating is another opportunity for an intermediary. So if you think about what's going on in Chicago right now, where Rush Medical is working on systems to get data through fire resources and send them to the city of Chicago, and then the city of Chicago is going to forward those that data on behalf of the institutions to the CDC and FEMA. That's something that would be, I think, useful to be able to demonstrate that, you know, if reports are pushed up to a server, there's a way for the server to then push out a CSV format that would match what FEMA, or not FEMA, CDC has on their website for the CSV, sorry, too many acronyms, CSV files. So it seems like it might be a good idea for Michael and I to break down some of those roles, and then back to Jared's question about aggregation. And I think somebody else had a similar question on the aggregation side. To be able to take a number of reports that have been sent to a fire server and then be able to aggregate them up at a regional level. Be nice if there was an intermediary that was able to accommodate that and do that in a location sensitive way.
Yeah, I can do that.
And make those reports available to others as if that were something were happening at say state public health or state level HIE working with public health to support some of the reporting that would need to happen at regional level. And I'm sorry, who was saying I can do that?
Sean Zitello.
Ah.
What specifically are you going to do, Sean?
I just, aggregate whatever. I mean, whatever your query is, right? We're going to query your fire server, and I guess we're probably going to query it based on organization or location. I don't know what else you would query on specifically, but whatever the query results, then whatever that bundle is, just aggregate that bundle into a report. So yeah.
Nice.
Keith, this is Aaron with Onyx. I'm trying to just figure out where we can add the most value if the team has most of this squared away.
Well, so first off, in terms of adding value, I think having multiple instances demonstrating that people can accomplish this is absolutely okay at Connectathon. We're not trying to say you can only one person or one organization is going to play a role. Already there are 3 organizations putting up fire servers that are going to expect to be able to receive data. And the point about Connectathon is really testing that when you have multiple organizations implementing from an implementation guide, that they're all sort of doing the same thing in terms of sending and receiving data, so that we actually get that we've described everything right and the directions are clear around how it's supposed to work. We're also, not working in a society where somebody's going to build one great big fire server in the sky that's going to support all of this. We know that the states are all going to do their own things. They're all going to go for competitive bids and other sorts. So means there's going to be multiple implementations in the real world,
right?
That need to work together.
Isn't it? Maybe I'm not quite understanding, but don't we need to test the ability to get data and aggregate it from multiple sources?
Absolutely. Yes.
Yeah, absolutely.
Yeah. So in fact, I think that it's not just that we have to have more than one person testing out exactly the same, or one entity testing the same thing, but we need people to be aggregating across multiple. That's a critical thing. Multiple sources. So
I agree. I think to be really successful at this, I would want to see any role that we're testing that we have 3 different systems playing that role and testing with all of the other partners.
Yeah, and that's very much aligned with both what IHE and what HL7 have sort of outlined as success criteria for Connectathon or fire development testing. Fire maturity model is actually based on that magic 3 number.
yeah, and on the terminology side, it would be nice to make sure that people are actually pulling, representing things using the same kinds of codes obtained, I want to say, from the same place. But anyway, so there's lots of things that more than one organization doing it is going to be important to test.
So you guys have some scenarios defined, and you have some, hopefully some images, because I want to make sure that I'm tracking properly.
When you say, I'm sorry, when you say images, I'm not sure what you're speaking.
I've not seen any representation of a measure report generator or measure report consumer. I've seen you define them. I'm just trying to figure out, rather than using the abstract terms, can we equate which one is the hospital in this story and which one is the public health entity?
Absolutely. Let's go over here, and we can jump from the Confluence page for the track to the link worked yesterday. All right, let's do this instead. That is the project. That is the implementation guide. Excellent. So there's a link here to the SANER draft implementation guide. This is a continuous improvement build. And in here, among other things, are
Section 5, actors and transactions, I think is what you're looking for.
Wait.
No. Volume 1, Section 5.
Oh, okay. It's like, I thought it was way higher than that.
1.5.
Yeah.
Gotcha.
Yeah.
There we go.
So there are this is the point of an IG, right? Explaining this sort of stuff. And I wanted to link to this rather than replicating all of it in the slideshow, but we can spend some time here if we need to talk through these to make sure the roles are clear.
So, and I think one of the challenging pieces here is that measure source and measure consumer are abstracted roles that don't really have, for example, the hospital, state public health, or state HIE, or any of the federal agencies sort of depicted. This is material that we are working on for the guide to show some examples of how this could be put together. And another section that actually has some of those examples, but not as clear as we would like them, is also in the section on architecture, which I think is section 2 of the volume 1 content.
And so in the idea of abstract actors, you can think of it like in a baseball game, there's somebody who's a pitcher and somebody who's a batter, but that's what they're doing right now in this one pitching interaction. The next half of the inning, those two people could be reversed, unless you got the designated hitter rule, and the other one's the batter.
Or you get further along in the workflow and the batter becomes a runner.
Yes, exactly.
So that's all good. If there's any way I can help you guys draft those images, let me know.
Was that Aaron?
That's Aaron, yes, sir. Or Mark and I, one way or another.
Yeah, we can.
Because we're presenting some of these things to folks on the government side, ASPR, HHS, and CDC. And the pitcher-catcher analogy is about the level of where they're going to follow this conversation.
Yeah.
Yeah.
You and I get
great
this.
Analogy.
Thank you.
And the policy questions they're asking are exactly what you're saying, Keith, that the state public health may be a catcher, but they become a pitcher to the national level, depending on what the final policy rules are.
Yep. And I'm working on that deck internally to explain to my leadership, and then trying to turn that into something that I can include in this guide.
Is there any reason we can help you with that? I don't.
Yeah.
No,
Absolutely.
Yeah. All help is welcome.
Yeah.
So I'm going to do something that I know lots of technical people are reluctant to do, but for the sake of simplicity, I'm going to give a simple, blunt, heavy-handed example that's wrong, but that'll work for moving forward and talking about the scenarios.
Awesome.
That's great.
The measure source is a hospital. The measure consumer is a public health agency.
Yep. That's what I was hoping to hear. or that's what I understood, thankfully.
Stop it. Okay, so scenarios. I added, whoa, this is not my notes for this. I added 3 scenarios. By no means are these the only ones we have to do. And in fact, we don't even have to do these 3. Consider this a starting point for the discussion rather than anything prescriptive. Okay, so the first scenario, scenario 1, is having somebody generate a measure report and having somebody else consume it without having a prescribed way that it gets from one to the other. While the later scenarios are more ambitious, this one is at least testing at a content level that what somebody generates and what somebody else consumes are going to work together. The precondition is that the source should already have data that would populate the report, and I would recommend making data that are realistic looking, as opposed to something where you end up with a whole bunch of zeros or a whole bunch of the same number for something. The success criterion for this is very simple, that the measure consumer just has the data afterward. Second one is the produce measure transaction, which I'm jumping back over to the IG here, and transactions, here we go. So produce measure is a transaction where the source is pushing a measure report to a consumer. And so for this one to work, in addition to the measure source having data, the measure consumer has to be exposing an endpoint where the source is going to be able to post data to it. So in order to succeed at this, you already have to be able to succeed at the first one, but on top of that, you're pushing the information. The third one, query measure, is, hopping back to the IG, another one, and this is just the opposite client-server relationship with the same source-consumer relationship. So to very unrealistically carry forward the previous analogy, in this case, the telekinetic batter is pulling the ball toward him or herself. So in this case, I didn't finish the sentence here. The consumer is the one that has to expose an endpoint for the measure report create interaction.
So this might be a case where, say, state public health is exposing an endpoint that has the data that has been sent to it, and somebody that can visualize that data in a geospatial way,
Right.
would be able to pull that data and do something with it.
Right.
And it doesn't necessarily mean they're pulling it at the time the visualization's created. It might be that they're pulling that data on a clock, grabbing it locally so that they can, pre-compute a lot of the essential data that they need for effectively producing and visualizing the results, because you don't want to be pulling data from 1,000 hospitals to report about a region.
Right.
And speaking of visualizing results, the second and third scenarios have a bonus point where the measure consumer, after getting the data, performs the communicate results transaction, and I've pasted a bit from the IG here. So this would be the opportunity to show off visualizations and other reports.
This is your dashboard, your trend report, or perhaps even demonstration of alerting as some state starts to pass some threshold on a trend. Maybe it's gone 14 days on a descending trend with new cases. And so that's just a note that some barrier has been broken, and maybe it's a good one.
Yeah, and this is what we're seeing our clients do in spades at every level of government right now.
Right.
You know, even outside of this, you know, I mean, you know, OD map for the opioid epidemic, you know, we've seen same type of models that are there. So, yeah.
All right, so now is the opportunity to add more things that we're missing. I want to let Aaron and Mark go first because they already have talked about wanting to do something with SMART. You guys want to take it away?
Yeah. So one of the things I know I volunteered to contribute on the security side. I think one of the things is trying to just make sure that the ability to, for example, register Smart on Fire apps and potentially connect these consumers and publishers of data, that we can actually issue credentials so that the transactions can actually happen. We want to see that that is something that is also, I think, somewhat scalable.
So I have a point on that. I just put in the Smart on Fire functionality, and like I have a question around test patients in that regard, but also the feasibility of doing bulk data, because the charting servers are like one chart at a time, so we can't really do like measure reporting in bulk there. So like I agree on clarification on the Smart on Fire authentication versus bulk data, and like I also have questions around that.
Yeah, and you know, part of it is bulk data may make sense when you're doing enterprise level stuff, but if you're a CDC person trying to look at gathering patients under investigation reports, right?
Right.
That's individual
Right.
submissions of a completed app, right? And at the end of the day, we need to be building these data collection tools to support as many use cases as possible.
So,
Well,
so just a point of clarification though, right now, is that we are right now looking at measures and de-identified data, and
Right.
what we're looking at reporting, and it's fairly obvious there's a connection from, hey, I've measured this particular occurrence, and somebody saying, well, I need to get down into the details of this, but just to make sure that you know, yes, we're aware that that's a natural extension point, but also want to be sure that we don't, you know, there's already, I think, probably 50 organizations involved in this project, and if we start getting into contact tracing and case reporting level of detail data, that's quickly going to double the size again of the activity that we would have to deal with.
Yeah, this is just demonstrating the utility.
Yep.
Right. So
Yeah, see, I think the question there is. Go ahead.
Could we clarify Smart workflow on Smart backend services workflow? I feel like that there's a difference. Like I feel like Smart comprises both like front end application, but it also has the back end services where you exchange the public key. And should we clarify around that?
I agree. I think backend services is the only thing that really makes sense here. Is that what you guys were thinking about?
So maybe it helps if we just sort of say what, you know, the fantasy would be, the fantasy scenario, right? Is that there's, you know, 400 or 500 app developers who all build to this SANER solution, right? Or at least one from every EMR vendor being used in a hospital. There is somebody within that hospital that's authorized to submit data to a public health authority on their behalf, right? They register apps to this state health authority's application server, right? That app gets registered, it gets a token when it's approved by the state authority, and then it's able to write to, you know, in the Measure Consumer API, right, the results from hospital X through whatever the authority of the submitter is. And then off of that, you have aggregation across the country at various levels of granular of authority, where you can aggregate the data and report it back out. Right now, just talking about, the first step is to, and I'm trying to get back to Keith's point because I don't want to disrupt the flow of Keith. But at the end of the day, right, so testing whether or not we can share fire resources that are predefined could be the scope of this entire Connectathon, and then we wait till the next one. I'm just trying to get a sense from you of how far you want to go.
So what a lot of it comes down to is what people want to do and what they are capable of doing.
Right, I hear you.
And if we've been doing a bunch of work over the last month on the steps other than this. I agree completely that this is important. If we're going to do it and get value out of it, people are going to have to do some development ahead of time. So Aaron and Mark, would you be willing to kick off a discussion on Zulip about this? And assuming we can get people actually doing it, I would love to do it at the Connectathon.
I'm happy to do that, Mark. Mark and I can tag team that.
Yeah.
At the end of the day, nothing happens at this Connectathon in like 3 weeks if folks haven't got a Smart on Fire app to wrap around the rest of it.
I have to disagree with you, and the reason I have to disagree with you is because there are literally dozens of HIEs that are already connected to hospitals that already have authorized communication channels and networks set up with hospitals, where the hospitals are transmitting, where the communication is protected, and those channels already exist for handling some of that support, and some of those HIEs are already connected to public health in that context. So it is valuable to be able to support the app developers, but the essential nature of Smart on Fire to support this for what vendors are already doing and connecting to CDC, I mean, that's happening today.
Exactly. And what people are doing today is emailing around CSV. So every step we take with this makes it easier for people.
Yeah.
Well, they're not just emailing the CSVs, they're reporting through the National Healthcare Safety Network right now through that infrastructure that's set up there. Because that was the only way to bypass, local and state public health, because that's the only reporting mechanism that I'm aware of that goes from hospitals directly to the CDC to traditionally report the hospital-acquired infections to address the reimbursement, cutoff for Medicare and Medicaid, due to hospital-acquired infections.
Yeah.
Jared, what was the name of that system?
National Healthcare Safety Network. Last time I checked, there was about and this was about 2 weeks ago, there was 1,300 hospitals in 23 different states reporting in to that. And if you go look at the NHSN website, they lay out the measures that they're collecting. Yeah. I think that's populating.
They're the authors of
You dropped to zero off of that. It's
13,000, right?
Yeah, it's virtually every hospital in the country.
That's where I'm trying to get to.
No, they're that many.
I work for NHSN.
Yeah,
it's a huge number of facilities. It's virtually everywhere.
Yeah, I get what you're saying, but they're reporting hospital-acquired infections. How many of them are reporting these new measures?
That's voluntary at this point.
Yeah, and I heard there was between 1,300 and 2,000 last time I checked.
Gotcha.
That could very well.
We've got about 5 minutes left, and there are a couple of things we want to get done for the orientation. The two big things I'd like to hit are what additional scenarios we need and what measures we should actually be using. Are there additional scenarios beyond the ones that we've got in here, plus one doing Smart on Fire, that people need to explore? Okay, for measures, I put in as a placeholder and a start for discussion using the CDC metrics and then the measure that SANER defines based on that. Do people want to do that? Do people want to do something else or some combination? What's your pleasure?
So I think that if we look at the CDC measures, that's certainly one thing. There was also some discussion on Monday's call about the 2 new measures that have come out with questionnaire and questionnaire response being turned into a measure. And I don't know if there's any interest on anybody's side of being able to pull that into this Connectathon, since we only brought it up on Monday and we haven't even had a chance to get it into the guide.
I think that would be a little tight.
Yeah. The only thing I can share is we're also participating in the Gravity Connectathon, which is questionnaire driven. So there'll be lessons learned from that to inform the next Connectathon.
That sounds fair.
And it sounds like somebody's covering that, so we would.
Yeah. It's just sharing a question. You know, here's the questionnaire, render the questionnaire, collect the response, store the response.
Yep. And I think but I think the important part of that is turning a collection of questionnaires or a singular questionnaire into a measure that can be aggregated up.
Yeah, you're taking the responses and aggregating them in some way.
That would be that would probably be different than what we're trying to do at the SDOH level, because it's the individual patient that we're trying to match to social services.
Right, but if you look at what's coming out of, say, Massachusetts and the reports that they just announced, they're actually able to give some of those same measures that CDC is asking for, but stratified by age in 10-year units, gender at birth or sex at birth,
right,
and race and ethnicity.
Nice.
And so, you know, if folks are able to provide measures that have those that stratification, that's certainly a huge issue. One of the things that I know facilities in Boston treating patients are seeing is that it's the poor areas in Boston that are the hardest hit.
Yeah.
Okay.
Yeah, and I believe the next bill, the US of Care, actually requires that states report by race, age, ethnicity, gender, et cetera.
Interesting.
Sorry, the next version of what?
The bill that just went through the Senate. I was reading about it last night.
Yes, yeah, the $485 billion thing.
Yep.
Okay, so for now, does anybody object to the CDC measure being at least one thing that we do?
Good.
Excellent. If there are additional measures that people would like to have included, bring them up on Zulip and we can see whether there's adequate support for them.
Any interest on the FEMA measure, which is basically supporting in-hospital labs?
Sure. Yeah.
I'm sorry, who was the short from?
Oh, I'm sorry, Sean.
Yeah, I just didn't see your name light up because
okay, probably too far.
Because I was staring at my notepad, not at my screen.
Yeah, and that one's a good case just from the developer standpoint, because it's a little different from CDC. It's just slightly more complex, right? Because it has nominators and denominators, and I know that's a little thing, but programming solutions, you love it.
Yeah. You said nominator, and I've heard other
numerator. I always do that.
Okay, so you're not the only one. Hans also says nominator.
Yeah.
Numerator. Okay. Numerator and denominator.
It's been so many
Terminator, isn't it?
Even had to hear those terms, though. I mean, I'm trying to think when I last encountered them before this project.
HQMF and quality reporting in 2010, 2011 for meaningful use.
Okay. Yeah. Good.
Okay, so we are at noon. Keith, I know in the past you've had another call on this line at noon. Does that give us a hard shut off?
Katie can answer that question if she's still on. Katie?
Yeah, we do not have a hard end for this line. So anybody who is free to continue can continue to use the line.
I have to drop for another. So.
Yeah, I got to drop too.
Oh.
Okay, go on, Aaron.
I'm sorry. Earlier on, when Michael was going through the deck, he shared that he was recommending that you made your data distinct so that you could recognize it in other services. Are we not passing like a provenance resource with the measure resource, or what are we not that far yet?
Well, one, we're not that far. Two, it's typically the FHIR server that addresses the creation both of provenance and audit event resources in most typical implementations.
Okay.
Because in that way, it's an authoritative resource as opposed to something somebody just crafted and submitted along with it.
Okay.
And that way, you know, this data was submitted by that, you know, user that was somehow authenticated on, you know, it might be through VPN authentication or other sort of, it could be smart or other authentication, so that you've got sort of an authoritative statement about who created the resource, et cetera. And similarly on the provenance would be recording who did what and where it came from, that sort of information.
Yeah, I get you. And that makes sense in the first, you know, from the hospital to the state, and then the state should have provenance of which hospital it came from to pass on to the feds, and that they were the ones that passed it on, right?
Mm-hmm. Well, there's always the question of how to deal with provenance, whether you pass the provenance along or whether it's traceable. In other words, you can get back to the source. You can then get back to
Give a reference ID or something. Yeah.
Yeah, the originator.
Yeah, that makes sense. Then just expose an API and allow you to discover it.
Yeah, because otherwise provenance quickly becomes bigger than the data that you're passing along.
It very well could. So maybe that's just a thread on the chat we don't necessarily try to tackle here. I was just trying to think if there was anything that, you know, kind of stood out that I wanted to suggest we add to the list.
All right.
So as far as you know, kind of next steps, right? Mark and I will get on to Zulip, and then Keith, if you would like, we'd love to help you with that deck you're working on, especially if you're going to publish it in the IG here, and we'll use it for the same purpose with our senior management.
Yep.
How many folks do we think we have that are subscribed to be participants? Has everyone committed yet, or are we still waiting to see that happen?
Nobody's committed yet, and the mechanism by which you're formally supposed to commit is not yet available.
Is that the survey?
Yeah.
Okay.
So I don't know, Keith, how long do you think we should wait before we just make our own?
Well, I'm already tracking a list of people who have said yes, and part of how I track that list is people who say yes, I'm going to participate, either to you or to me, and wind up getting their name put up on that list in Confluence. Yeah. And I have some folks who've said yes that I've been meaning to add to the Confluence list because they can't edit on Confluence.
Gotcha.
Do we have any notion that anyone that's going to participate can support the Smart on Fire flow?
That's a good question.
So I know that Abigail has done, and because she said earlier on the call, has done some work with Smart on Fire and just added a Smart on Fire module to the work that her company has been doing.
Okay.
I think for a lot of organizations that are already developed tools to generate measure reports, a lot of the reporting that they're already doing is through otherwise secured channels to either state public health or federal agencies. And so it's not as essential. We're not seeing at the moment a lot of folks wanting to develop apps say, to do this. It's more being thought of as infrastructure in that context. And so it's going through a lot of the normal flows for infrastructure in terms of, setting up the secure link if you don't already have it, or using an already otherwise secured link.
Right.
And certainly in the case of health information exchanges, which are already connected to hospitals, I suspect many of them would just use the already existing mechanisms that they have in terms of, say, certificates, which are commonly used to verify who's actually doing the connection.
I don't know if this is the right place to have that conversation, but I'd love to pick your brain about that, because that's a concern of mine, to be honest with you, right? Like, are we going to rely on the existing stuff forever? Are we going to try and move forward? Like BSA is a Smart on Fire system-to-system backend solution that wouldn't be as rigid or dependent on things being defined mutually between 2 points.
Well, because being able to make that connection involves signing something like a BAA in a lot of cases, or a similar sort of agreement, there's a lot of other overhead that just doesn't fit into the smart workflow from that perspective. So that's sort of where a lot of that, I think, comes from.
Yeah, I think we can do better, is what I would say. Maybe not.
Yeah, I can't argue the point.
Okay.
I've spent the 6 months in organizations, in HIE organizations, working out all the legal details and the contract details.
Yeah.
To turn around and then be told, go turn that connection on, and have 6 days or even 6 hours to do it. Right.
Yep, that was the state HIE policy SME for California back in the ARA days. So I know very well what you're talking about.
Aaron, to answer your earlier question, will anybody be able to do it? It depends on how much of it you're talking about.
Okay.
Epic supports smart backend services as a client and as a server. And so if we manually built the credentials or manual exchange the credentials, we'd probably be able to do that. As far as some central body that's assigning them, I love the idea.
Yeah, I think so. Just with what we built so far, right? During the Connectathon, you would be able to register your client. And within the account that we create when you register your client, you would be given the client ID and secret to embed into your client.
Oh,
and we would approve you for access to the APIs related to this IG. And then your client would, if we'd go ahead and create the authorization flow, we could authenticate your end user, right? And they'll give you a token that says, to get to Keith's point, downstream, we're going to be creating the provenance, and we'll be able to say, it was this authorized user who submitted this data at this point in time from this client.
Does it have to be a human user? Because a lot of the stuff we're working toward is having systems that collect the data themselves and then share it on a schedule or on demand when somebody queries them.
So there is, there's this flavor of Smart on Fire, which is the back-end services that's still being matured, right? I think it's being used in one use case. But we're looking at that, right, and trying to figure out, is that the way to go? Because ultimately it should be system to system, except when you do really have to know who it was that submitted it.
Yeah, so just an observation from my front, the challenges that I know some are having are just getting it to fire. And so a lot of what you're talking about would be either a distraction or a barrier at this stage.
Yeah.
At this stage.
I hear you. Until people start, there's bad actors in the world. That's all I'll say.
Yeah, no. totally clear on that piece.
Yeah. I just worry, that's where we end up. We're already being.
And so this is definitely why we have a security work group to go go look into this.
Mm-hmm.
It's just that, okay, so if I go back to my first Connectathon with cross-enterprise document sharing, which is
Oh my gosh, I
honestly
remember.
the foundation of what's being used in the QTF now.
Yeah.
Some of those same transactions. The first Connectathon ever held, we were doing our transactions over HTTP, not even HTTPS.
Yep.
Because at the time people weren't ready with that capacity. The next one, HTTPS was definitely part of. And thereafter, it wasn't just HTTPS, it was the full-blown ATNA profile in IHE.
And I remember very, very well the HTTPS requirement in 2006 because Vasile and I were scrambling to get that done. And Keith, you made it clear that if we couldn't, we really shouldn't be in the showcase.
Yeah,
right.
Hey.
And I don't think you were wrong. You know?
Yeah, no, and I can't argue the point even. I just know that we have to make sure that we make it possible for people to be successful here, and that we look at, because we already know, this is going to go to Connectathon 2 and Connectathon probably 3 to get thoroughly tested. And so there will be opportunities to take and make sure that we've got all the right pieces in place.
Yeah, no arguments either way. This is Connectathon stuff, and I'm stuck in trying to figure out how do we fix this so that at scale, when it comes to fall, it's better.
Oh yeah. My new deadline is next flu season.
Yep, exactly. Right, and so the hope would be I thought Hans might be on this as well as SANER and Epic and a lot of at least the hospital facility side EMR vendors are part of this, right?
Yep.
And we have, I'd love to talk to this Austin Kessler guy about how they actually, if they have an OpenID Connect method of identity proofing the authorized submitters.
Or an NHSN?
NHSN, yeah.
Yeah, so if you go to the CDC website, that we have listed as in the CDC measure, that'll actually take you to the NHSN COVID-19 module site, and from there you can learn a lot about all of the details and pieces. But NHSN, it's the National Healthcare Safety Network, and there's a whole process to getting your hospital connected to the network.
Okay.
That is very much like getting a hospital connected up to a health information exchange that involves contracts and agreements and all of the rest of the stuff.
Sure.
As well as the other detail, and I can almost guarantee that any sort of automated process is going to run into a lot of barriers from the federal side until somebody says, you got to show me how this is going to make my job easier and how this is going to make sure that all of the criteria that they've got are met in terms of securing the data, because they're just as worried about bad actors coming in. And if you have an automated way to provide credentials, that's already going to set off alarm bells. If there's not a way to verify that the organization to whom the credentials are being provided is an organization that would be authorized by CDC to even transmit to them.
Right. Exactly. But with $1 billion in funding, we'll be able to fix it, I think. Or maybe I should say we're obligated to fix it, right? It's not like, let's just do a little bit better. Let's actually fix it.
Yeah. No, I completely get you.
And I totally get you, because I've ran tracks, and it's just like
Understand. We're not the only one looking at that $1 billion with stars in our eyes. So you know, it's got to be proven, and it's gotta be worth it.
Yeah.
So, all right. Well, thanks a lot, everyone.
Thank you, sir.
And
Thank
Aaron,
you.
I'll reach out to you separately on the
Thank you, kind sir.
other
Appreciate
topics.
that. Yeah, definitely. Talk to you soon.
Thanks, everyone.
Everybody.
Thanks, Mr.
And thank you.
Cheers.
Yeah, thank you
See ya.
tremendously, Michael, for driving this piece forward.
No worries. I'll talk to you soon about next steps.
Yes. Okay, Katie.